Welcome everybody. My name's Susie Scott. I'm the Everyone's Children Manager here at GCVS, and I'm chairing this first part of the session here. This is the sixth in the series that we've been running about the National Care Service, which Lynn Williams, our Social Care Coordinator, has organised for us to explore different aspects of the proposals for the National Care Service. Still to come, we have events on intergenerational working next week, which still has a few places left if people want to book for that. And also the Minister coming on the 8th of October. Unfortunately, that session is fully booked and has a wait list, but hopefully we'll be able to show the webinar of that later. Today we're focusing on the implications for children's services that might come about as a result of the National Care Service. It was only briefly mentioned in the consultation and wasn't part of the Feely review. So we're not sure kind of what to make of it, but we're hoping that our speakers today, Sally Ann Kelly from Aberlour and Mike Burns, the Assistant for Children's Services at the Health and Social Care Partnership, will have views and thoughts. And then, so what's going to happen is we're going to hear from them, then we'll have a Q&A session to further expand on the thoughts. And what I would ask you to do is to put any questions or comments that you may have in the chat function as the speakers are talking, and then we'll pick those questions up at the end. And my colleague Sheena Arthur is going to chair the Q&A session, part of the discussion. Then we'll have a very short break, and then we'll have some breakout sessions for general discussion, and we hope to take the conversation from that into the GCVS response to the National Care Service consultation. Okay, I'm assuming that everybody's now familiar with Zoom, and I don't need to do any Zoom etiquette. Ask people obviously to keep themselves on silent for the time being and say use the chat for any comments. So without any further ado, I will introduce Sally Ann Kelly from Aberlour, who's going to give us her take on the National Care Service and the implications for children's services. Take it away, Sally Ann.
Thanks, Susie. Can you hear me all right? Can you hear me all right? Yeah.
Smashing, yeah.
Okay, good. So thanks for inviting me today. Probably unlikely that I'm going to bring many answers to all of the questions that people are posing, because like you, I've been posing my own questions to the consultation. But I have prepared a couple of slides really just as prompts for myself in relation to what I want to say today. If you can move on to the next slide, thanks. I suppose some of my opening comments really are around the consultation itself and what it potentially means. And as has been alluded to, the inclusion of children's services in the consultation on the National Care Service came about a bit left field. People hadn't, I think, generally anticipated that. I was always a wee bit suspicious, to be honest, that children's services would be included through a process of what I called stealth, but actually, it's in there in the consultation. And I suppose we could speculate about why it's there till the cows come home. My point is that the fact that it's there and there has been no prior consultation with children and families in relation to its inclusion is a bit of an issue for me in terms of the overall ethos, as we are told it is, in relation to the National Care Service being inclusive, and one that talks about engagement with our citizens and choice, for big parts of that to be included without prior consultation, it seems to me, presents many questions to us about how that came about. That said, it's there, and I think that we need to take the opportunity to ask those questions and many others in relation to where children's services could fit or sit. I suppose what I would also say is that, you know, I'm long enough in the teeth to have gone through a number of structural consultations on local government reorganisation, integration joint boards, the GIRFEC and integrated children's service planning processes, to name but a few. And I would also always urge caution about structural responses to what are systemic issues, because I don't think any of those responses in and of themselves have actually answered some of the challenges that we have within our country in relation to making sure that especially the most in need and the most vulnerable citizens actually get the support they need at the point that they need it. So there is something in there about making the point about structural change not being a panacea and us needing to fix the systemic issues, much and many of which are a result of, for me and for many people, a weak culture within organisations, which is about command and control, which doesn't pay attention to the inclusion of citizens as masters of their own destiny, if you like, and does too, rather than works alongside and delivers with. So there is something about the cultural change that needs to be included front and centre, I think, in responses, because albeit these documents are big, it's a big consultation document, it doesn't pay enough attention to the cultural shift. And frankly, if we are going to instill the same behaviours that are across our systems at the moment in the new system, then we should expect the same results as the current system is giving us. So there's something fundamental there. And from a children's service point of view, I think we need to argue that keeping the promise has to remain an absolute priority for us. The promise and the independent care review did what many reviews have failed to do. They took a really person-centred approach. They involved children and families from the outset and throughout the process in shaping the messages that came from the care review and you know how they were set in the promise document. So we need to, I think, argue really strongly that the aspiration that the promise articulated, the vision that it painted for us of a Scotland where children and families were properly supported and were able to access support when they needed it, that has to remain a priority regardless of what happens. And I suppose that brings me on to my final point in terms of the opening comments. I don't hear anybody arguing for the status quo, so the status quo is not an option, and that means that change is inevitable. So I think our job, and certainly my job in terms of the structures and the organisations that I'm involved with, is to ensure that what we try to achieve here is change for good and not change for change's sake. So that's something that I think we need to think about in our responses. The status quo is not an option. There will be change, and how do we then support processes to try and shape that change in a way that makes sense for children and families. If you can just move on to the next slide. Thanks.
It's frozen, Sally Ann. It's fine.
It's frozen.
The choice of technology today.
Okay, I'll just keep talking if that's all right.
Eventually.
So what my next slide would have said, if you could see it, was that what I think we need in terms of our engagement in this is a real focus on relationships and not the structure that we're trying to create, because it's relationships that change systems and it's relationships that shape the outcomes for people. So if we can really focus on what that system needs to be guided by, and which is, frankly, human interaction and connection, and what the principles around that are, then I think that that's something that we can take forward. We need to bear in mind this consultation is the first step in probably a number of different steps that will be available to us in terms of commenting on what happens with the National Care Service, whether children's services are included or not. And if they're not included, there will be consultations around what is created for where they should be, if you like. So I think we should play for me, the long game here in terms of keeping posing questions about what it is we want to achieve as a country. So some of the principles for me of changing systems and changing how we do things are there's fundamental principles that I think that we need to deploy. And I've spoken to people in CCPS and within the Children's Committee there, but also on the board, and also other folk within the third sector. And any system, if you like, or any new structure that we create really needs to hold within it a fundamental power shift for the people that are reliant or dependent or choose to use services or support. And the power shift needs to come away from professionals to citizens. And that means that we have to do a number of things to enable that power shift to take place. And the first of that is that professionals need to accept that they need to cede power. I have been involved, and probably still am involved, in systems that have let people down. And I think part of what we need to bring as professionals is a level of humility to this, that acknowledges our failure in the past and in the current, and actually gives a commitment to having a different kind of social contract with our people and a different kind of commitment to our children and our families. And that is one which is based on a more equal relationship with those people. Because if we are to accept that children and families are our equal partners, we also accept that they have the greatest insight into what makes the biggest difference in their lives. And we need to listen to what those opinions are. And I mean, listen in a really deep way, not listen to contradict, not listen to undermine, but listen to help our understanding of people's situation. Within health, we often hear the term do no harm. We should employ that term within a new National Care Service, within children's services, where as a state, we accept that many of our interventions, as I've alluded to previously, have done harm, have actively harmed families. And we should give a commitment to our citizens, to our children and families, and to ourselves that we will do no harm, which means that some of the gatekeeping that we've employed, some of the decision-making that's based on organisational needs and organisational resources needs to be reviewed in this new system. And if we can create a system that's driven by the principle of do no harm, then that for me it would be a really good starting point. There needs to be compassion at the front and centre of our system. Too many times we hear value judgments being made about people who use services, who have to rely on additional help. We need to make sure that our system is well resourced and as compassionate at the centre, and our folk who are working in the system don't experience compassion fatigue. We've all heard the comments that people have made about families who have perhaps presented for assistance and repeated times, and the victim blaming that goes on at times, and we need to actually challenge that. We need a whole system which, with relationships at the heart of it, understands the complexity of what families experience. And we need it to focus on the whole family and the well-being of the whole family, and not see families within families of silos. And within that, we need to be really clear. With the UNCRC incorporation, it gives us a brilliant opportunity to do what I talked about earlier, and that is recalibrate the relationship the state has with its citizens and put their rights at the front and centre of what it is we do. And if we're clear and we're authentic about doing that, what we will also accept is that we need to offer choice where choice has never been given before. So when we construct services and we expect people to bend themselves into the services we construct because we think those services are a good idea, we have to stop doing that. We have to actually listen to what citizens say they need, and services or support needs to be bent in a way that fits the citizen rather than the citizen having to bend into services. Too many times we hear of young folk who have got significant disabilities who simply cannot access any of the right supports because they don't exist, because they are too rigid and they are not broad enough to encompass the needs of the young folk that we're talking about. Too often we hear of carers that are completely exhausted because their caring responsibilities are such that they don't get a break, and there is nowhere that they can safely allow their relative, their family member to go. We need to think again about how we actually you know, set up that relationship with our citizens who are also carers for people in their family. So that is about real choice. And the next bit for me is about how those systems actually are shaped to make them less complex. Sorry, I've got a cough, it's not COVID. We have systems that are incredibly hard to navigate. And what we need to do is make sure that we make them less complex for people. And there's something in there within the principles of this review, which means that whatever we construct needs to be accessible and needs to be, you know, streamlined in a way that means that folk who need help get the help that they need at the right time in the right place. And my final point, sorry, because I'm just about to go into a coughing fit, is around commissioning and procurement. Again, we need to ask questions about how commissioning and procurement's done. How do we address the fact that our people who rely on support are not involved fundamentally in designing the services they receive, and how we actually do that in a new National Care Service. So I'm not answering the question about should children's services be in or should they be out. What I'm saying is, whatever we create, these are the principles that we need to look at, including to make sure that the outcomes that we have for our citizens can be as positive as they can be. My basic premise is that structural change without the cultural change that goes alongside it will change very little for our citizens. They actually needed to be included in this journey, all of the journey, not just small parts of it. And that includes local authorities stepping back, health stepping back when they need to, in terms of that commissioning process, to make sure that the views of our citizens are at front and centre of that and are involved in that process.
Okay, thanks, Sally Ann. I think we are still having problems. Mike's struggling to connect to the system today. So what I'm going to do is to move to some questions and comments on Sally's presentation in the hope that that gives Mike a little bit more time to overcome his technical difficulties. And if that doesn't happen, we do have Mike's slides, which we can show you, but unfortunately we won't be able to comment on because they're not our slides. And then you know, we can move to break after that. So as I say, we'll take some questions and comments just now, and we do have one in the chat just now. So I will ask Douglas Wilson if he wants to expand on what he said in the chat, or repeat what he said in the chat. He's saying more of a comment than a question. That's absolutely fine.
It's more a comment and a question, and I suppose it comes from a kind of a fairly jaundiced view, having Bill Sally Ann been involved in public sector since the late 1980s, and it's just, to me, it's rhetoric versus reality here. It's a top-down. You know, we'll look at the structures, but we don't really change anything much. Moving the chairs in the Titanic, a bit of the SQA kind of review that's probably going on at the moment as well, and it's just symptomatic of government at the moment. I think I really do, and so I find it frustrating. I think Sally Ann's absolutely right. Structural responses rarely deal with the actual issues, and it's just, to me, just without funding is fundamental, and has been identified by Audit Scotland over recent years that the funding doesn't match the rhetoric and of government pronouncements, and this may well be another one that falls into that category. So it's just and a creeping approach. I think it is. It really has gone way beyond the Feely report, and suddenly thrown in all these other services, and I think that's appalling personally. Not to say if they were going to do it, at least, you know, do it the proper way. At least have some consideration and discussion and consultation before you do it. I find it deeply frustrating, and I think, as Sally Ann has said, many more questions than answers. But you know, it's probably, let's be honest, it's going to happen probably in some similar forms that's been announced, because that's the nature of modern government. Sorry, I'm just being a bit. I'm just really quite frustrated about the process, lack of how it's been handled, what's been included in it, unannounced, and I say it comes from a fairly cynical, jaundiced view, having over 30 years, and I just don't think politicians and civil servants really, or very often, don't get it. But anyway, I'll just be quiet because I'm just being a bit of a moan now, so apologies.
Well, I think, I mean, to be honest, Douglas, what you're articulating, I've heard articulated by many people. And I think the manner in which this has come into the consultation, I think, has just added to that. So I suppose what I would say is to folk who are considering responding to the consultation, think about what it is that's driving the move to a national care service in the first place. What is it that's driving that? As a citizen, I have to say that, you know, I share concerns about an erosion of local democracy. I'm not saying that local democracy works well just now. It generally doesn't. But it's a route in from a local level to look at what's happening locally and challenge what's happening locally. So there is something for me about the governance arrangements here having to be much more robust than they are at the moment in terms of including people. It's frankly not good enough to include one person from the community in an IGB or the like and say that that's participation. It's not, it's tokenism. So there's something much more powerful that needs to take place at a local level. I think the issue about finance is really significant. You know, there's been many initiatives that have been introduced either through legislation or policy change, including many of the changes for kids in care and entitlements to aftercare, which have not been properly resourced. So we have legislation that's great. We have pronouncements politically that are marvellous in terms of what we're going to do for our children. But actually the reality of these children and young people's lives don't change significantly because councils haven't been resourced adequately enough to do the things that they need to do. So there is a disconnect there. I suppose the issue for me is how do we, as a third sector, as civic society, you know, focus on meeting those issues with the greatest, clearest challenge in that. And that for me is for us to come up with very clear principles, as I've tried to do today, and to repeat them over and over and over again, alongside our concerns that structural responses to systemic and cultural change won't work. They don't work in the private sector and they won't work in the public sector. But here is a blueprint that we think you can take, learning from things like the promise, learning from the people-centred changes that have been done probably in many, many third sector organisations, about how change can be taken forward with citizens and the people that actually rely on the services and support at the very centre of it.
I think that's probably something that's come through a number of the other discussions that we've had on the National Care Service as well. I'm going to bring in Sheena, who's our partnership manager, who's been involved in all of these discussions, for her take on it, and also to pick up some of the comments and questions that I see coming in on the chat as well.
Thanks, Susie. Hi. Yeah, I'm Sheena Arthur. I'm Partnership Manager for Health and Social Care at Glasgow Council for the Voluntary Sector, and been privileged with colleague Lynn, who's been coordinating all of these events, to hear all the conversation from our third sector partners around, as Susie mentioned earlier, relating to the Feely review and what that means for National Care Service. And there's some strong themes that have come up throughout these events are coming up again. And thanks, Sally-Anne, for your insights and your powerful presentation. I think one of the key things that has come up through all of them is this, the power dynamic and the shift in power. And I know that's without feeling like I could quote Mike. I've heard him speak in some of the work we're doing within the Health and Social Care Partnership, and that's one of the reflections that he's made about really that not doing too that Sally was talking about really hearing, listening to people, and a bit of a shift as professionals in feeling like you've to have the answers and know best and take the risk and carry the responsibility. And I think there's something, if we've got the time, which we seem to have just now, could we, think about that? What would that change in power be like? What can we do to support that? And I've said this before, last year I was, well, people just need to let go of that power. And now I understand it's not as simple as that, because the people with the power are going to feel the insecurity that a lot of people live with every day. So I'm not making an excuse about it or saying it shouldn't happen, but what can we do to support that change in power, to support people to let go of it? What would that look like, and how could we find a way of doing that is one of the questions that's coming up for me. In the chat, I see Ian has put, about the real challenge about that gap between the rhetoric on place and localism and the reality in our approach. And there's something about that that's coming through today as well, about what's being described and what's actually being experienced by people. And that's come up very much in our events as well, that Sally Ann touched on, the impact on carers not being able to get a break, not having services, and the place that people are in right now. We can think about a bright new future, but actually what's the reality for people right now? I'm coming up with loads more questions than answers, I realise, Susie, but some themes that it would be good to get people's thoughts on, their ideas about how we can perhaps suggest some solutions for what we know is important.
I don't know if you want me to come in, Susie. I mean, I suppose, I qualified as a social worker in 1990. When we still had the regional council. So when I first qualified, I worked for Strathclyde Regional Council, then it went to Glasgow City Council. I've been in South Lanarkshire and also in the East Ayrshire Council before I went to the third sector. So I've kind of done a tour of duty as such. And I suppose the thing that strikes me is when I trained as a social worker, I trained on a community social work course, which was about actually supporting communities and families and children locally. But also we saw very clearly part of our job as an advocacy role for folk. We knew we were going to be working with the poorest folk in society. We were going to be working with people that had been dealt the harshest hand in society. And part of what we needed to do was look at how we advocated for those families and those children. And I think what we've seen over the past 30 odd years, and it's part of the reason I no longer work in statutory social work, is a growth in the state in terms of the structures of what it is we provide as a state, but a simultaneous retreat from the relationships that we were focused on previously. So I think nowadays social workers will have less time than I had in terms of building relationships with families, because what's also got in the way, as far as I can see, is a kind of managerialism and a process-driven culture, which demands, certain things of profession, some of which is very right. But because there's not enough resource available to basically resource the whole system, you have scarce time that you're allowed to spend with children and families. So for me, there's something about redressing that, just changing that and actually freeing up really people that in the main I perceive as compassionate, committed, principled individuals to spend the time with families and children and the wider, older people, people with mental health issues, that whole group of people within our society that needs that compassion, because too many people are telling us that the very profession, if you like, or the very support structures that are supposed to offer that compassion, that non-judgmental, unconditional, positive regard for folk, are actually there's something happened, which means that people feel judged and people feel as if they've been given very, very difficult things that they need to try and achieve. So there's something for me, and that's part of the cultural shift that I think we need to make, about revisiting basic social work and social care values and what that means for how we interact with our people, and how we support people to tell us their experiences in a way that helps us help them, if you like. And part of that, I'm not saying that's easy, but it's certainly something that we need to do. The fact that we've constructed whole structures of things like home care around individuals, where you hear word of older people being put to bed at 7 o'clock at night because the system can't send a carer when they actually want to go to their bed at 11 o'clock at night. That for me is fundamentally the wrong way around. So we need to, and that's going to cause problems, frankly, if we look at that, because we'll need to change people's working arrangements. We'll need to, there will be disputes with trade unions. There's a whole host of things that will come up, but that's not a reason for not doing it if what we're doing is right for our citizens. So I'm not saying it's easy, but I definitely think if we have the humility to step back from all of this and actually think about what we've constructed for organisational sake and what actually we need to construct for the good of our people, I think we would come up with different solutions.
Yeah, thank you, Sally Ann. And that going back to basics, if you like, going back to what people were trained to do, why they came in to the profession, that's something that's been coming up, and I think it actually came through in the Feely review, didn't it? People feeling like they couldn't do the very role that they wanted to do. And you mentioned time, having the time. Do you think if we gave people the time, it's not always about extra resource, but time is the most precious one. Do you think that in itself could help people feel like they've got the time to have a conversation, to hear what people are saying? Yeah,
absolutely. I mean, a lot of what we do at the moment is transactional. It's about writing a report and submitting a report and doing a time limited assessment. There's also been pressure on for families not to be engaged over a long period of time. I've always argued that for some families there will be support going into families forever, and that's okay. We've been seduced by this notion that if you put a programme in for 12 weeks and we get to the end of the 12 week and there's not been any improvement, then there's something fundamentally wrong with the family as opposed to something fundamentally wrong with the programme. So there is just a very different approach, I think, to how we support people. And that means it's beyond just transactional stuff. That it's a relationship we're trying to foster and develop. Part of that, yes, you need to do reports, but I'm sure if Mike was here, he would be talking about things that have gone on in the past around time intervals for hearing reports and all the rest of it, and how that impacted on social work practice at the time. So there's a whole host of things that are system driven, but are not relationship focused and are not family focused.
Thank you, Sally Ann. And that system, the sort of system being made more of the priority than the people is something that's coming through very much as well. Thank you. Jay Smith has been waiting patiently with her hand up, so I'm going to there's a few hands up, so going to go around the room, if you like, to let people have their say. So thank you. I don't know what your name is. So
hi Sheena, thank you. Joanne Smith, ANA's PCC Scotland. That was really helpful, Sally Ann, thank you. It feels like impossible to take a position on what the National Care Service will need for children based on the really scant information that we have. But you can see the planning push around building on the success of Girfbeck, which in itself I think warrants a bit of a challenge, you know, of consecutive research, including the PCC research last year, into challenges from the front line, have found, as others have mentioned, that it's an increasingly crisis-led service environment, with families presenting much later and with much more complex needs. So if we're seeking to build on the success of Girfbeck, I think we need to kind of learn about what's happened over the last few years and how successful would Girfbeck have been if it was actually resourced appropriately rather than looking at structural reform. Now, having said that, there's two kind of pressing issues for me. I think in terms of resourcing, the Feely Review concludes that there's a need to oversee an actively managed market, and it does allude to the involvement of private companies or others providing support services, whereas the promise stated really clearly in a point of principle that there would be no profit in the provision of children's services. I wonder how we marry those two things. And of course, if we are supporting adults through private contracts, then that inevitably, if it's not a kind of quality of care that we would expect, then it inevitably impacts on child well-being and development and family functioning and all of that. So I think we need some clarity around that. But like you, we have to find the opportunities here. The status quo is not an option. And I think that the use of an integrated ICT system is a potentially really significant step forward. If we can have a much more dynamic use of local data, then we've got the potential to identify risk earlier and intervene at an earlier point where we're able to affect change. So I think that there are opportunities in having a kind of centralised IT system, but ultimately we are intervening too late to support families. So we really need to have that local insight in order to build a preventative service response. So I think that we're looking for the opportunities, certainly, because we recognise it's probably a done deal. And I think the big strength is the opportunity that centralised data collection presents.
I mean, one of the things I said during the presentation, Joanne, and you'll know we've had many conversations about this, is the need for that preventative early intervention. Yeah, too many of our social care and social work systems are crisis driven. Because we've not paid enough attention as a whole children's sector to the needs of families much earlier on. We've got rising levels of poverty. It's a disgrace that in 2021 in Glasgow, in some of the areas, you've got 1 in 3 children in poverty, 1 in 4 at a national level living in poverty, and the stresses that brings for families are well documented. So it shouldn't be a surprise, the number of families that are in crisis. So there's something materially that we need to address in relation to that. But there is something also about how early we support families and how we deal with eliminating the shame that there is attached to asking for help, because every family needs help. And we need to make sure that the system, whatever we create, acknowledges that and puts no shame or judgment on requests for help. Yeah,
thanks, Sally Ann. Thank you for struggling on. I can see your throats. That is something that I have heard Mike talk about the change in trying to have a preventative approach. So trying to support a family before they need that crisis intervention or that high level support. And part of it is a more constructive conversation and not having the shame of needing that support. There's a whole big culture change needed. Other hands up. Lovely to see you, Selena, from the Family Fund. I'm going to invite you in, and then Claire, as we patiently waiting as well, Claire Simpson. So Selena, nice to see you. Would you like to
Nice to
come in
see
with
you
a
too,
comment?
Sheena. Lovely to see you too. I just want to say thanks very much for hosting the event. I've been finding conversations like this and presentations like Sally Ann is really helpful, because it's one of these ones where the more you look at something, the more you realise the enormity of it, and the potential implications of it. And I work for a family fund who support families who have a child who's disabled or has long-term health condition, and part of our role is to ensure that we one of the things we do is try and engage with families so that they have a say in matters that affect them. And obviously this potentially is going to affect both children and young people and their parent carers and families enormously. So it's been quite a tricky one to grapple with in terms of how do we most effectively engage with families and support them to have a say with limited resource to do that. So I say this is really helpful even in terms of how you position things. And I think for me, one of the things is that's coming through for these conversations is the opportunity. I think somebody used that phrase just there, maybe you, Joanne, the opportunity that this presents, because families can't give us all the answers and what their views are, because there's such scant information about actually what this means. It's far too abstract just now, but I do think it's an opportunity to both reiterate with families, to emphasise with families their current rights and entitlements, and to speak back to government about families' current rights and entitlements. I think families might be quite frightened about the potential for structural change that will take years. They can't wait. They can't wait till this process comes to an end and structural change like that takes place to have this person's needs met. And Joanne made a point that I've made before as well. Is the first thing I noticed looking at this consultation was the fact that it says based on the success of getting it right for every child. And whilst getting it right for every child is a brilliant approach, its implementation and the understanding of it is, there's not a consistent shared understanding of it yet. It's not consistently implemented. It's not something that families feel. Quite often families don't feel that it works for them, it works for their child. So yeah, sorry, I'm wittering on, but it's just say I really appreciate this. I think, and it's been really helpful in terms of being able to get to grips with it, communicate what this is to families as far as we know it, and what the opportunity is for them as well to speak to a system, if you like, and speak to government about what they need. I do think families have told us lots of times before. So yeah, anyway, I'll finish at that. I think that was my key things. So thank you.
Thanks, Selena. And I think that the point, it's really important what's currently, what is in place. We've heard that in other sessions. There's already some good things in place, but they're maybe not being implemented in the way intended, or in a way that really hears what people need, whether that's young people or adults and older people.
Yeah,
So
can I just say something to Selena, because I think Selena made some really good points there about the change and when it's implemented, because social care and social work has come through many changes, and public sector's come through many changes, and I suppose my experience from a senior manager's point of view in local government and since I came to the third sector, is that periods of significant change, that risk can increase for what you're doing as an organisation, and risk in terms of something going wrong, but also risk in terms of the sustainability of the certainty of what you currently deliver. Because if you're in a constant state of flux, it actually becomes really difficult to continue the day job, if you like. So there is something there for parents and for families, I think, to seek assurance around. that because, you know, somebody said earlier on, I think it was Ian in the chat talked about our poor track record in relation to implementation in Scotland. And that's right. I don't think we should presume that it's going to get any better overnight. And therefore we should predict that there will be some barriers in our way in terms of the implementation of whatever it is that takes place. But what we should be asking is for an implementation process that takes time and allows families to continue to receive the support they require, or because we can't stop supports to implement a new system. That would be wrong. So there's something about how we actually twin track any changes to how we deliver and how we take families with us, rather than again knock on their door and tell them that their care package has been reduced from 40 hours to 20 or from 20 to 5 is the more likely scenario. Do you know, so there is something there about how we actually support families to use their voice to protect their families' interests as well.
Yeah, thanks Sally Ann. I'd like to invite Claire to come in, Claire Simpson.
Okay, very much agree with a lot of what's been said, and Selina's points about families and how they're going to view it or see it, and particularly with views about, you know, structural change and actually how it doesn't really get to the heart of things, and the fact that, you know, Sally Ann's saying, well, we should keep the promise, and in some ways I feel that it's almost already been impinged upon or broken by people by not consulting children and families on whether this should be included in the first place. I think absolutely relationships are key, and I do feel really concerned about local accountability and governance. But actually, the thing I was actually going to say was about early years. I felt quite confused about this whole process, and I'm quite reassured, you know, hearing people around the room, that actually I'm not the only one. So I suppose I'm not even sure if children's services should be included. But given that they are at the minute, and that's where we are, it seems that early years is not included. And I've had a few people come to me with concerns about this. And I think their specific concerns are, if it doesn't sit there, where does it sit? How is it regulated? And how can we have a whole family approach where people might have children who are in the early years and children who are in school and who need a package that encompasses the whole family? Do we go back into those silos? And the other thing that people have expressed particular concerns to me about is that within the National Care Service, there's a link to fair work and how wages and salaries are calculated and a guarantee there. And if early years sits outside of that, does that then mean that it becomes a poor relation and a kind of, you know, wages, salaries, conditions in the sector have not been conducive to quality and to attracting people into the service? A lot of work's been done on that in recent years, but it feels like this would be a really retrograde step. And it feels like the particulars about whether early years and children's services and how they link up and whether they should be together in there haven't really been thought about very much.
Yeah, I think that's right, Claire. And far be it from me to suggest that it might be possible that the people that have been doing the thinking behind this don't properly understand children's services. But I'll leave that there. But I think there is an assumption amongst some that early years should sit, can sit neatly within education, when you and I know that it can't, because it's much more complicated than education or health. There is something in there clearly in relation to some of our most vulnerable wee people that we need to be really sighted on. I think the other thing that's not clear in all of this, it doesn't mention protection services, it doesn't mention public safety, it doesn't mention child protection. You know, my background is child protection, so I'm not sure where that sits or fits anymore. So yeah, I think these are all questions that need to be asked, and I think your question about the potential inequality across workforces, if parts of the workforce are subject, you know, you know, the Fair Work agenda applies to one and not the other. You know, it should apply to them all, frankly, without condition. So yeah, I think there's big questions in there. I think the other thing, Lynn's also put some stuff in here really around how we plan recovery for services post-COVID. I mean, I probably, you know, there's been lots of discussion around care during COVID and what happened within our older people's homes and our nursing homes, and that will be subject to public review, and I won't comment on that. My own dad's in a nursing home. I have many thoughts and views on it, but I won't comment on it. But it would not be a surprise to me if part of what has driven these changes and the pace that they've been made is in fact COVID and what happened in terms of our nursing homes and our wider social care system, because I think it was, we've argued for a long time about under-resourcing, and I think the adult sector and older people sector has been in a more acute state than children's services, to be fair. But it was laid bare, wasn't it, during the pandemic? Nobody could run away from the fact that under-resourcing had catastrophic consequences for folk, and that they were undervalued and underpaid. So, yeah, so I think there's a legitimate question there that Lynn poses about recovery, because it's not the case that social care services are fully operational. Some families are still waiting on direct support. Some packages have not been reinstated following their removal during COVID. So I think there's something there about where does all of that fit in a national care service? How are those packages going to be reviewed and resourced? Lynn, I don't know if you want to say anything about that.
Yeah, I was just
sorry, Sheena, that's fine. No, it's fine. No, absolutely. This has been an amazing discussion, and thanks, folks. I think you've given us a lot to think about in terms of our response. But I wanted to emphasise the recovery point because of what you're saying, Sally Ann, and I suspect this applies to a lot of children's services too, where the support that many families relied on either disappeared or was reduced in some way. I mean, know that that's the case. So I know that speaking to organisations like PAMIS and others, that many families remain unsupported 19 months on from the start of the lockdown. And in that context, we are seeing particularly disabled children and young adults who have regressed significantly in that time. So that also has the implications of the closure of NHS services as well, which we haven't discussed here, but has implications for these families too. So, you know, access to things like physiotherapy, speech therapy, a whole range of services before you even begin to think about things like universal credit cuts and all the stuff that's coming down the line. This is me speaking personally, not as GCVS, because I think for GCVS we're still shaping our response, and what you've said today will help us do that. But for me personally, I kind of want to say be careful what you wish for here, because I think what we're in danger of doing is going down the structural route again. For those of us who lived through the integration of health and care in 2013-14, we said all the same things then around the focus on structures and processes, and my concern is that we're doing that, and I think you picked it up really well, Sally Ann. The whole issue around the workforce, I think, is critical. So Claire's points around that, I think around pay, we cannot recover these services until we actually value these services and pay people a decent salary and develop career paths in all of these areas that give these services the value they deserve. And you're talking about people who are delivering often life-saving stuff, you know, in terms of social care, and yet, you know, we're saying they only deserve at the best £10 an hour is really not acceptable. And I want to sort of, I was speaking to a carer yesterday who's speaking at our event with the Minister next week, and she has an adult son who's profoundly disabled, and her concerns, and she'll share that, but I think for me is that by adding children's services in at this point, and others, because we're talking about things like potentially justice, criminal justice, mental health, is that we're diluting the focus away from adult social care here, and particularly things that around the transition from children to adult services. So there's a lot of stuff here that I think I agree with everyone that there's a lot of confusion here, I think,
there's a lack of clarity. And I think we're in danger of losing some of the great stuff in Feely. For me, is there was some fabulous stuff in Feely that I finally had, as a carer myself, like I said, I'm a full-time carer for my husband, as I finally had hope. But what we've seen over the pandemic is there's now no longer a social care safety net for many families. That has gone. So there's a lot, I think, around the recovery for me. I think a message from GCVS and from all the stuff we've done in this series is the focus on recovery is important, is that people do not have the support they deserve. And unless we address that, then we can't move on and reform these services in any way. So I think that's all I want to say, but I appreciate everyone's, my head's spinning here with all the different issues that we've raised here about, what do you think about here? So I think I'd be happy to continue discussion with people separately, in terms of how we shape that particular part of the response.
Yeah. I think you're right, Lynn, and certainly CCPS, I'm on the board in CCPS, and we're at pains to point out to government, we will be pointing out very strongly to government that this is a 5-10 year plan in terms of the creation of a national care service, in terms of its full implementation. The workforce can't wait 5 years to be properly valued. That needs to happen now. So we cannot allow this massive change agenda to take our eye off the ball in terms of the fair work agenda, or the need for us to radically overhaul procurement and commissioning. That cannot be paused because of the National Care Service consultation.
Absolutely, yeah. The commissioning stuff's really important, and that has implications for many of us in this room around the commissioning stuff. So if commissioning for many of these things sits at national level, what implications does that have for local organizations, some of the organizations that are members of our GCVS, but others, and there's some of the great stuff that goes on that's completely preventative and often saves lives. Is how are these organisations funded? So again, these are questions that we'll be asking around that. Is what does that mean for commissioning tendering?
Thank you. We've managed to use all our time without having Mike here, which is we'll need to have another space and great discussion. Thanks so much everyone for contributions so far. There's more comments coming in and people sharing links, so thank you for that. Please take your thoughts and ideas with you for our next part of the session. We're going to take a short break, and when you come back you will find yourself with technology willing in your breakout room. We are going to, there's some comments about Mike's slides, and I think from discussion with colleagues he is comfortable that we can share his presentation, so that will be shared, and we'll work out some way of getting some input from Mike at some point. But there will be someone in your breakout room who's there to support and facilitate discussion. We would like you to develop your response to the Feely report and the potential inclusion of children's services within that. Think about the opportunities and the challenges, any concerns about having that, which we've started to touch on. Also that point that's just really been made about the current challenges and the urgency of what's needed now, because this is a longer term discussion in terms of the National Care Service. So are there current immediate challenges that people want to make sure are flagged up, and anything that you want, as has been said, we'll be collating this in terms of a response. So if there's other key points that you would like raised in the response. So do take a break, and then we'll be coming back into breakout rooms at 3:10, if that's okay with everyone. And then we should have around about half an hour for discussion before we come back as a wider group. But any discussion or sharing of links we will share after the event, and as well as Mike's presentation. So thanks everyone so far, and we'll see you shortly.